Buenos días con todos.
Good
Es un
morning
gusto darles
to
la
everyone.
bienvenida
It's a
el día
real
de hoy.
pleasure to greet you to today's
Antes de
session.
dar inicio a la
Before we
sesión,
get started
quiero
with
asegurarme
the
que
event, I'd like
todos
to make
tienen
sure that
acceso y
everyone
saben cómo
has
operar
access
la traducción de este
and you know
seminario,
how to
que
use the
tendrá
interpretation
presentaciones en
feature
inglés.
in this seminar,
Por favor,
which will also include
para escuchar
presentations
la
in English.
traducción,
In order to
asegúrense de
access the
ir al
interpretation
signo de
mode, just click on the globe icon on the bottom portion of your Zoom screen where it says interpretation, and you can select the language of your choice from the pop-up menu. As I was saying, it's a real pleasure to welcome all of you to today's session. My name is Carla Sainz. I'm a regional bioethics advisor, and it's a real pleasure for me to greet you to this sixth session in the series of virtual seminars on clinical trials. This is an initiative that is organized by the Regional Bioethics Program, which is part of the Science and Knowledge for Impact Division, the Evidence and Intelligence Department for Fostering Health at the Pan American Health Organization, and the Medication and Health Devices Unit, which is part of the effort in innovation that we have engaged in towards safer medications and devices. Today, we will be discussing responsible conduct and research. And before we delve into the topic, I'd like to specify that we will not be issuing any type of certificate for any participants. I would invite you to access the Regional Bioethics Program's website, where you will be able to review the recording of this session and where you will also find the recordings for the previous sessions. And you will also be able to enroll or register for our research ethics registry, which is where you will be able to have access to future scheduled seminars and other materials related to research ethics. Now, today's session, as I was saying, will revolve around scientific integrity and ethics in research. I'm sure you all remember that this is a topic that is included as one of the objectives and indicators for PAHO's ethical research work, and it's clearly an area where we still have a lot of work to do. During the COVID-19 pandemic, our region faced many challenges with regard to scientific integrity. And for that reason, if you go to the guidelines outlined by PAHO and several emergency guidelines, you will see that one of the topics that was identified as needing more work in the region related to scientific integrity. For this reason, we are organizing this session with Dr. Patrick Weitzel, who is an expert in these topics related to how to conduct research in accordance with the corresponding scientific integrity standards. He has a PhD in immunology, an extensive experience in research before focusing on these issues of scientific integrity. At first at the National Institutes of Health, NIH, here in Washington, and subsequently he has held different positions related to scientific integrity, both at Houston Methodist as well as NASA, and in 2 universities in Texas, Texas A&M and UT Austin. Without further ado, I would like to yield the floor to Dr. Weitzel. And I did want to add one more detail. For us at PAHO, it has been very important since we began the first conversations on this topic of scientific integrity to have an overview of scientific integrity informed by science. We need to understand how research is conducted in health, how science is applied, because we believe that this is at the very core for countries such as those in the Latin American Caribbean region who are starting to establish scientific integrity systems and that can benefit from lessons learned here in the US. Go ahead, Pat. You have the floor.
All right. Thank you so much. Everyone can hear me okay? Wonderful. Okay. And everybody's got my slides here. I don't like to read off slides to people, but I did have a few things that I wanted to bring forward. As Carla mentioned, I have worked in various areas around research integrity and research compliance throughout my career, within the federal government, within state universities, within NASA, various teaching and professional affiliations that I think gives me a broad background on this particular topic. And within research integrity here, I'm told that I'm meant to focus this talk primarily on things related to clinical research, and I will try to do that. But as I said, I don't like to read slides off to people, so hopefully we can get a discussion going on the points that I wanted to bring forward after I get through what I have to present today. I have for you 5 key things that I wanted to bring forward, and Carla brought this up in the introduction, but I know a lot of institutions, particularly in the developing world and in Central South America, coming out of COVID, coming out of the pandemic, are looking at some of the issues that they faced during that time and some of the concerns that came out of that, and looking at ways that they may be able to revamp or build anew their first or their research integrity programs at their institution. And so I'm presenting this from an institutional perspective, from the perspective of potentially a research and academic biomedical research institution who's looking at building out their research integrity program. And I wanted to bring these key points forward. I've got 5 of them for you today. The first of those is probably the most fluffy, the least substantial, the least data-driven that I have for you, but I'm bringing it forward first because it sort of leads into the others, and that's that we need to focus on the organizational research climate overall within our institutions when we're rebuilding our research integrity programs. And what that means is just the patterns of life and behavior related to research activities within all the organizational members and the leaders within that organization. And so why am I bringing this concept forward? Why am I focusing on this? Because within our institutions, we have all sorts of different roles, and all those roles have different goals. Whether you are at the early career stage, whether you're at a later career stage, whether you're at somebody in university administration, or whether you're on somebody on the other side who's funding research and working with these institutions, you all have different roles in the process, and henceforth different goals in playing that role in our process. And so while we need to acknowledge that we all take up different spaces within our organizations, but we need to use that, and we need to use that awareness to foster a sense of shared meaning and purpose within our organizations. And so what drives this motivation? Some of you may be familiar with the SOURCE criteria. It is a set of criteria that came out several years ago, and there's been, probably now 15 years of research applying this construct to different research integrity programs, different stakeholders' experiences with research integrity at their institutions across different fields and across different career stages. And this is what, just without delving into all the nitty gritty of that data, this is what people determine are important. What the research determines is important in building out a good research integrity program. It's having resources in place, and a lot of it, I wanted to point out, has to do with norms and socialization, lack of inhibitors. These are environmental factors that lead to positive research integrity. And so across the board, when we're looking at the effectiveness of research integrity programs, so much boils down to these environmental factors, the integrity norms, the way we engage with integrity processes in our day-to-day work as researchers, and how much that goes into the overall feeling of effectiveness of research integrity at an organization and the overall positive feeling that people at that organization are acting with integrity. When I bring up sort of these red flags, this is an example of one of those research studies that applies the source criteria. They found that when publication performance is rewarded with cash, where mutual criticism is hampered and people are afraid to speak up, these are things that work in opposition to good research integrity. And so you can go into the literature and see quite a lot of research out there that relates to assessment of research integrity programs, but it very much all boils down to that institutional morale, to having that shared meaning as an institution that focuses on research integrity despite different goals, different research aims, different things going on throughout the institution, having that be a focal point of belonging to that institution. Ways that I've seen this first key applied effectively in the past at academic research institutions include when they bring in patients and patient advocates, when people in the research enterprise have those opportunities to engage with people on the clinical side and people on the clinical care side, even if the people not as involved in the research, but the people involved in clinical care and the patients themselves, having that attachment and having that engagement to big picture and big picture accountability can influence positively the overall feeling that people are acting in the best interest of this big picture and therefore applying sound research integrity principles at your institution. Shared values, mission, and purpose as an organization, having those continual engagements with research integrity. I'll talk a little bit about this under the fourth point, but having that as a routine part of doing research business at your institution, having those ongoing engagements with research integrity practices and concepts and being able to recommit to those, and having a visible research integrity program that includes consequences for broken trust. And so when that's a component of your program that's highly visible, that people are aware of it, that's a strong influencing factor that encourages people to act ethically. You're not going to get a lot of support in this regard from your governments, from your funding agencies, from your various oversight bodies, even your philanthropic funders. They may all have policies, but you're not going to get a ton of support. At least, in my experience in the U.S. and with other countries, governments rely mainly on assurances. Your agencies delegate most of the research integrity responsibilities to your grantee institutions, such as yourselves. So this brings me into my next point, where we talked about having that shared meaning and purpose as an organization and understanding that with the agency support, the meaning can get lost in the minutia. It's more about rules and regulations. they rely mostly on assurances, and that it's mostly up to the organizations, the institutions themselves, to ensure an effective program. And the second point I wanted to bring forward with you is that institutions can always do more. Very often, your policies as they relate to research integrity come to you from the agencies that fund your research. And while they all have policies relating to what you should do if there are ever any concerns about research misconduct, or how to report things to them, how to go about COI management, all of these sort of things that fall under that research integrity umbrella, agency compliance with those regulations is the minimum standard. That is the standard, but it's the minimum standard. I want to impress upon you, if you're rebuilding a research integrity program, if you're considering strengthening the research integrity program at your institution, consider that your institution can be better than the bare minimum. Those agency compliance standards are a minimum standard, and some examples of ways that I've seen this applied in the past. People, your definition of what is misconduct can be broader than the agency definition. You can write your own employment policies. You can have your own standards for your researchers that go above and beyond the state of mind definitions and all the formal FFP sort of definitions like we have in the United States. The agency will enforce those and you will report according to their guidelines. But as an institution, you have the right to set your own standards in excess of what that agency tells you that those might have to be. You can choose to be more transparent with your conflicts of interest. You can choose to be more transparent with publishing management plans. You can choose to be more transparent with publishing data in excess of what's formally required. We talk about clinical trials in the US, obviously clinicaltrials.gov, that's the requirements. And certain data sets are required to be collected and reported there in a particular way. That is the minimum requirements. There is nothing stopping you from going out and publishing data sets. The only thing that could be stopping you would be a data agreement that you have with the sponsor of a study, for example. But institutionally, you can set your own standards and your own rules. You can vet papers. You can require engagements in those RCR training programs for individuals of all career stages affiliated with your institution, whether or not they're on a training program, whether or not they have external support that would require them to take a RCR, responsible conduct of research curriculum. You can report institutional findings in greater detail than the agency may want you to at a particular time, that the journal that you published in may want you to be public with at a particular time. This all plays into your reputation as an institution, and that's the next thing that I wanted to sort of bring about in discussion of these key points that I think people sometimes overlook when they are building out their research integrity program, is that those agency standards are a minimum standard. But at your institution, you can set your rules. It does come with an obligation to inform and train your people, but your RI standards can be a part of that institutional culture, and making it part of that meaning and purpose behind what you do as an institution, and having those continual engagements allows you room to raise those standards and impress those expectations upon people that they may not be used to, that they may have come from a prior institution and not have the kind of enhanced research integrity standards and the kind of enhanced engagements with those concepts required of them that, may have been required at former places of employment. Requires a lot of institutional buy-in to do this. But in the long run, these things can be time savers to unburden your investigators and serve as fail-safes for things like data backup and some of those sorts of functions. I want to advise you to consider these things if your institution is looking at data record keeping and data storage, electronic lab notebooks, cloud platforms, things like that, that if you're implementing something institute-wide, work that into the cost of your indirects and that sort of thing, of course, but make sure it suits your institutional needs. I want to talk about this in the context of making these investments in the interest of your risk, your reputation, and your quality as an institution, and why having that front of mind in the long term really outweighs the short-term costs, the short-term administrative burden, and the productivity that it may cost in the early implementation stages or getting people accustomed to your research integrity standards as an institution. We all know of scandals and things that have happened around the world. We still think when somebody brings, as a research integrity guy, when somebody brings up Duke, my mind still goes to what happened at Duke several years ago. And this is 5 years old now. But we think about it, even different institutions around the world. You think of Riken in Germany. You think of the one in Sweden, whose name is escaping me now. Different places around the world. These sort of incidents take a real hit to their reputation, and there are implications that these research integrity lapses and things that go public and things that governments have to respond to and may make the news impact even your academic standing and your reputation as that's concerned as an institution. There's a lot of positive reinforcement out there, and this is where you can make a name for yourself as an institution, as a positive force for research integrity, somebody who takes it seriously. Even if you go out on retraction watch, they like to go out and congratulate and thank institutions for going out and doing the right thing. When somebody goes out and corrects a study that they know is wrong, they will label it doing the right thing. And you can go there and you can see that, hey, there are institutions out there doing the right thing who are setting the standard. And you can, whether you're a patient, whether you are somebody considering working somewhere, working with a collaborator at your institution, whether you're a funding agency, having that as part of your reputation as somebody who takes research integrity seriously is a lot better for you than having this be what pops into people's heads when people bring up the name of your institution. So really, really think about what this means for your reputation and how research integrity can affect your reputation. One of the biggest things that impacts your reputation as an institution from a research integrity standpoint are these research misconduct investigations. You will have one. This will happen to you. There will be something that happens online, on PubPeer, on a publisher website, on a private blog. We all saw what came out, Data Colada, recently over the last couple of years with the Riley and Gino group at Harvard. This is going to be happening more and more. Data sleuths out there, Elizabeth Bick, looking at your images. It could be an innocent mistake, all sorts of explanations, all sorts of examples out there. But when this information comes to light, it's out there in the public. People generally become aware that that institution is looking into the matter. Whether that institution has said something or not, they have to comply with their agency standards, their government regulations. And so there's at least an awareness out there that that institution is looking into it. Within the United States, we have certain timelines and timeframes that are very often exceeded. And so we get into a situation where that complainant, the people out there who perceive that there may be an issue with your research, become impatient. and you're not quite sure what to do with the published research record. It's sitting out there, but there's allegations that something is wrong. You've got issues at your institution with that respondent, if they're still working, with that person at their institution. You have a PI, you have other people in the group. There's issues of trust. It's generally contentious. It's generally awkward. How are you going to deal with that as an institution? How are you going to replace resources that you had to take to do this misconduct investigation? If you're not accustomed to doing this as an institution, if you only have limited experience doing this, you need to be prepared for the eventuality of having to do a big, ugly misconduct investigation, and having this plotted out ahead of time, having these sort of questions answered, or at least having a plan for how you're going to move forward and address them before you initiate something. This is going to help you a great, great deal. Having these misconduct investigations go quickly benefits you. It benefits your reputation. It benefits everybody who's still working at your institution. And it requires that foresight and investment. That's the third key that I want to bring to you, is that this enhances your reputation when you can manage these matters very, very quickly, whether it's clinical, whether it's basic research. Most of the time, there's going to be some awareness within the field, within your peer institutions, within the professional societies that work in your areas, that something might be amiss, whether or not there's an expression of concern. Do you want to publish that expression of concern? Is that journal amenable to doing this at that time? These are all questions that you need to prepare for, and may depend on the individual situation. And so things that depend less on the individual situation can be those data repositories you use, those record-keeping platforms you use. Did you think ahead? Did you install these? Did you implement these in a way that's going to allow you to go to your IT department and say, hey, I'm the research integrity officer. I need a copy of this, 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 and this, and I don't want them to know that I have it just yet. Are you going to be able to do that? Is that something that your implementation of that platform is going to allow for you? That really, really helps as a research integrity officer. Do you have the ability to go in and do things like that? Do your background investigations before anybody becomes aware, and then can you use that? Do you have an ability to obtain an admission from the person that you think may have committed the misconduct? I had the pleasure of taking a course in police interrogations from a consulting company that worked with the NIH in federal agencies, and I found that training to be very, very beneficial as a research integrity officer. How to have those first conversations with a respondent after you've done your evidence gathering, and you have basically a pile of evidence that you know what happens, but you're trying to prevent a long drawn out process by obtaining that admission. There's no dark arts there. It's really just about being able to present that evidence in a way that impresses upon them that their best option is to go ahead and own up to it and let this process go quickly and as painlessly as possible. So having that support in place before you need it. Do you have an ethics committee with members that you can draw experience from and utilize as potential misconduct committee members? Have you thought about who those people would be? Are they the sort of people within your institution that will have the time to devote to that? And that time can be very intense. So I tend to like to use emeritus faculty, more tenure level faculty who may have more time to devote to those sort of activities. Once they get called in, the demands can be very intense. Are they already signed to confidentiality? Do you have all that in place? Can you initiate this as quickly as possible? And then on the backside, once you have an idea that, hey, the data is not reliable, we haven't gone through this entire process yet of coming to a determination about whether or not there's been misconduct, but we know that the data is not reliable. We don't want that sitting out there. That's going to be a question that you, as an institution, have to answer very carefully, and is going to affect your institutional reputation very significantly. What you do with that research that's out there that is under investigation. Like I say, people generally know. Do you want to go ahead and pull that paper? Do you have evidence that that data is not reliable? Can you separate that retraction notice from an investigation into somebody by simply saying the results are not supported or the data are not reliable? This is something I recommend as a research integrity officer, that the process of making misconduct findings can be very drawn out, but the process of discovering that the data is not reliable can take about 10 minutes. And once you've made that conclusion, going out to the literature and correcting that literature is your obligation as an institution, and other institutions, other governments, funding bodies will hold you in higher esteem if you go out and you make that correction quickly. And this is not about saving face in the short run, but this is about preserving reputation and your commitment to integrity in the long run. Journal editors are becoming more and more amenable to this. They care less and less whether it's misconduct or whether it's an honest error. You should reach out to them, those journals, and say, hey, we want to correct this research record now. If we have more to say about it later, we will say that as an institution. But for right now, we want to retract this article. This is a retraction notice that I helped write back when I worked at Houston Methodist. And it's an example of one I like to use just to illustrate that we said that the research was determined that the research was not performed according to our standards, and the supporting data don't support the findings that are being published in this paper. So this was prior to the point in time where we could make a misconduct finding, but very early on in the process, we wanted to go out and go ahead and retract that paper. So this was a misconduct situation that came out of a very unfortunate circumstance. And the reason that this happened, this particular one happened, was essentially because the principal investigator never looked at the underlying data. And whether you're doing clinical research, whether you're doing basic research, one of the big things that we took away from this situation, one of the things we learned from a situation that affected us at our institution, was that we need to engage in more career stage appropriate training for all of our research personnel. That PI never understood the importance of going in and looking under the hood on a regular basis, and certainly before he sent out any paper with these sorts of findings in them, that, to establish that there is good foundational data, that everything that we would expect to be there is there, that we could share this if it came to it at some point in the future, if there was ever data sharing requests. This PI never understood the importance of doing all that. And it's why we decided to implement more career stage appropriate training within our institution. It's been found many, many times before that the research training, research integrity, responsible conduct of research that we prevent to early stage investigators is very, very effective in enlightening them to different research integrity concepts, what they need to be thinking about, and different things that they go well above and beyond. Don't fake your data, which is what they assume research integrity always is. But these engagements with RCR courses, as we require in our curricula, really do, as we find out, open their eyes to different concepts and different ways of looking at research integrity holistically, and more than just avoidance of research fraud. And so this is just an example of one that was done in Italy. Students taking an institutional research integrity course, utilizing these concepts from the source framework, where they're looking at the effectiveness of this program for early stage researchers. But we know a lot less about how these engagements affect later stage researchers. And so research integrity is a mentoring issue, not a lecture course. And so this is the fourth thing that I want you to go away with, is that we often focus on training for earlier stage career investigators, but I don't want you to ignore, as people who are thinking about their research integrity program, the research integrity engagements that you do for faculty and PIs. Those research leaders at your institution, how are you engaging with them about research integrity related topics? Are you training them? Are you working with them in a way that they're going to turn around to their research group and set a good example to impart these research integrity concepts and incorporate them into their day-to-day routine of managing the group, managing the lab, managing the clinical research team? Are they incorporating these concepts that you're training them on, that you have someone like me at your institution to train them on? And are they taking that back to their groups and applying those principles in a way that's effectively impacting positively research integrity within those groups? So you need to be engaging with your faculty and your PI level folks on these concepts, how to incorporate data review into laboratory meetings, into the process of writing a manuscript or writing a grant, how to incorporate these discussions into mentoring, how to incorporate into performance reviews at the appropriate time. And so, within departments, you have to have, faculty time devoted to this, and having retreats and having faculty seminars and things is always a good way to do this. And having a research integrity person who's flexible enough to come in and give those talks and engage with those principal investigators is super, super important. And I think we could do a lot more as a research integrity community to focus as much on the faculty level investigator as we do the early level investigator, with trying to understand what we need to impart to these people so that they can effectively lead their groups and impart these concepts. So to avoid this feeling of administrative burden, my strategies are how to incorporate these best practices into your established routines, how to delegate them, and how to utilize the technology that you have at your institution, technology that's available through the broader community, such as disclosure databases, ORCID, et cetera, how to utilize these platforms to make your life easier, and having someone at your institution that can help folks with that is a really central focal point to an effective research integrity environment. So that's my final point: is have somebody at your institution who is your research integrity person, who does put that front and center, make them visible. Don't just assign it to a faculty member who you think might have time on their schedule or who can be your representative. This is somebody who it should be their full-time role. I know within the compliance environment at a lot of smaller institutions who have smaller research enterprises than some of the big institutions in the US, it may not be a supportable full-time position, but at least within the compliance office at your institution, it should be somebody who can focus exclusively when needed on research integrity matters. I'll bring up my example of why I decided to leave a particular position as a research integrity leader. Was at the point in time where that institution built a new office building and moved my office to a location that required a bus ride to get to the hospital. And so that took away from me as the research integrity director those elevator engagements, those sort of day-to-day sort of getting to know you, being seen around the research areas, those opportunities as somebody within research integrity to really integrate myself within the institution. And that made that so much harder for me, having my office located somebody somewhere geographically further away. So this is something that institutional leaders should think about. Are you allowing that person at your institution who's tasked with research integrity to focus on those things, to be an effective research integrity officer and leader, to be a relationship builder, to engage in teaching at those appropriate times, to be somebody that folks are comfortable reaching out to with questions, even if it's not a research integrity question. If you need to direct somebody to the IRB, if you need to direct somebody to another compliance office, you got to be that servant leader who can engage with those researchers and help them be focused, be present, be trusted within your institution. You need to have a seat at the table available for that research integrity officer. This isn't just a box to check. I know IRBs take it seriously when they are aware of potential research integrity issues, maybe things coming out of conflicts of interest where they want independent data review, and they want that consult from that research integrity officer when they call me in to a meeting as a subject matter expert to ask them to ask me if I feel additional research integrity related conditions are advisable for a particular study. That is completely the purview of the IRB, and that is the purview of a very responsible IRB. When they have that trust for the research integrity apparatus at an institution. And so utilize that person, trust them within your institution, and allow them to make relationships, and not just as the science cop, but integrate them into the training apparatus and being able to consult with your investigators on those compliance topics, because that will really open up a world of open communication about research integrity, and it all serves back to building that feeling of shared responsibility and shared purpose within your organization. That research integrity is something that is central to what we do, and it is always a part. We always see this person. And it's something that we take close to heart. So to finish up, just these are the 5 keys that I wanted to bring forward to folks that may be thinking about updating, making more robust their research integrity enterprise at their institutions. I know it's a broad, very, very broad umbrella with research integrity, and I know a lot of folks are doing more clinically oriented work, and so I'm happy to talk about maybe in a little bit more detail those clinical topics as we discuss further. So I don't want to take up any more of your time. I think that's all that I had to talk at you about. And now I'll hand things back over to Carla.
I believe that he opened like a complete menu of concepts, vocabulary, mechanisms, and it will be key to discuss this, taking into account our regional perspective. And in that sense, it is a pleasure for me to introduce Percy Maita Tristan. Dr. Maita is the Director of Research at the Scientific Southern University, and he is part of the IRB and Research Integrity Unit at the School of Medicine in the university. He has been working for several years on research integrity. He has published a lot of articles on plagiarisms, redundant information, authorship, etc. And we invite him so that from a regional point of view, he can comment on Dr. Biden's presentation. Good afternoon, everyone, and thank you for the invitation. Actually, this presentation kind of makes me switch gears a little bit about what I wanted to discuss, because it's good to bring it down to what's happening in our region. And one of the things we have seen in our region, and clearly in Peru as well, is something that has to do with integrity. And a lot of what Pat was saying is basic for those of us who do research day in and day out. It has to do with credibility and trust. And when we do things the right way, um, then reliability or trust in science is not there. I would like to share a few details with you because sometimes when we see a series of faults in the investigation, one of the most common responses that we get is this is not happening or this is not necessarily true. For example, when we talk about scientific fraud, when we talk about the fabrication, counterfeiting, or complete plagiarism of results from other studies, a study in 2009 reported that about 2% of researchers globally have said that they have committed fraud at some point. So one of the first things we need to take into account as people who work on research and that worried about ethics and integrity is that unfortunately not everybody that is in the science field do things the right way. In this case, people admitted themselves. And in addition to this issue of fraud and data manipulation, with the advent of AI, we have what we call science fake paper manufacturing companies. These are companies that work on scientific fraud and they sell their services so that authors anywhere in the world can buy authorship. They can buy a project, a thesis, an article, an episode, a chapter in a book, or a patent. Now, how widespread can this problem be? Now, this article said that in 22%, about 2% of the medicine, 2 to 3% of articles related to medicine could be impacted. I'm pretty sure that at least some of you have seen ads on social media to sell articles. In Peru, actually, we identify several of these sale networks that even resort to influencers. This person you see here is a celebrity in our country that used to advertise the sale of thesis on social. And this is not something new. Actually, 10 years ago, we started doing some research to see whether these thesis related services would actually sell you a thesis, and we realized that it was true. And this was 10 years ago. But what we found was that these companies that would sell theses in Peru evolved and now have their own scientific journals. And so they no longer sell their thesis, but also sell their journals from an authorship position so that someone can be qualified as a researcher in our country. The problem is that even though we started communicating this, there was no reaction from the regulatory agency in Peru that goes by Concitec. And so what happened was that we were able to leak their chats that these companies had with their clients. And we invited a journalist that was interested on this topic to join the chat. And then a year ago, we issued a special showing how easy it is to buy a scientific article and how easy it is to be part of a peer-reviewed journal. And these released a scandal in our country. And actually, recently in the National Research Integrity Body in Peru, it says that sale of these type of materials constitute major crime that results in being expelled from the system and having to pay fines. So Peru was able to go around the bank secrecy law from 3 networks, and they found that in these 3 networks, about $3 million had been moved around in about 3 years' time. And some of these companies according to the tax record, have up to 100 workers. So these are not small operations, and it doesn't happen only in Peru. Actually, these companies bought articles from Pakistan, and we saw that they were linked to other networks in the region as well. In fact, in this investigation by the Congress of our country, they identified that 60 renowned researchers in our country had money exchanges with people whose articles were found here. So this is not a minor issue, but of course it doesn't impact the entire community either. And the important thing is for the scientific community itself to take it upon itself to assess, identify, prevent these types of actions. And this is where the problem comes. We, as a region, have developed networks and institutional review boards to protect subjects. But when it comes to research integrity, there are not very many institutions that have a research integrity unit because the IRBs don't necessarily sometimes deal with integrity issues. And that's a problem. Why? Because if we don't have a regulation, if we don't have people trained in identifying that, we're not going to be able to prevent cases, detect them, or find the people involved, and let alone impose sanctions. And this is important because a lot of the offenders that we have identified are legally licensed and they know where they can go to. And they know where, in what areas they have to stay away from, or what units they have to stay away from because they could be fined. Currently in Peru, the Congress is working on a bill to punish the buy and sale of scientific articles as a crime, but our national entity does not have a research integrity unit yet, and I'm not sure if the countries in the region are going through something similar. So we still have a lot to do to work on research integrity matters because, like we've heard before, there's a lot to do. There's a series of things that have to do with this reliance on research because what's the point of research if there's no reliability and there's no honesty, even if it impacts just a few elements of the research. So this is basically what I wanted to do. Regionally, and we see this in Peru, there is a need to work on integrity matters and to train people because it won't be feasible to develop an integrity a unit if we don't have the people, the space, and the legislative framework to operate by. So that's what I wanted to share with you, and with we can, take it further if you would like. Thank you, Percy. And now we're going to go to the open discussion. I would like to invite Pat also to join us for this Q&A session. I would like to share with you. I tell you a little bit about the regional landscape. I believe Percy did an excellent job describing it. But from the regional bioethics program at PAHO, I can share with you how we have addressed this. We have research ethics systems indicators, and one of them has to do with research integrity. Because in response to requests we have received from the countries, we developed that. And also because research integrity is like the ugly duckling. We focus on research ethics, which of course is important, but we are still very far behind in terms of research integrity, and we need to bring these issues to the table. So going back to Peru's example, when we supported the health authorities to help them develop their national research ethics guidelines, we included a very brief research integrity component, and we included some basic definitions, and we urged the other parties, institutions, to take action and develop policies around that. This introduction, I believe, is the first step, which takes us to our first question. And the question is, so what do we do now? That gave us a very broad landscape of concepts, roles, responsibilities. And we can believe that here from the desert, start planting this big forest. So the question I have for Pat is, what would the first steps be to start acting preventively rather than reactively in terms of research integrity? So based on your experience, based on the knowledge you have about this huge landscape or forest that has no trees for now, which are the first trees that we should plant?
Well, thank you for the question. I hope I end up answering it, but I can't stop thinking about what Percy just brought up, about the paying for papers, and that being such an issue, and coming from the U.S. perspective, that's so much not on our radar as much as it is in other places. And so, if those are the kind of issues, I think that we're still facing in regionally, my focus is not going to be changed in the sense that I really think that this effort needs to be led by institutions, and institutions taking responsibility for the research that they send out into the world. So the institutions are receiving money to do the research. Too often are institutions thrilled to take credit when the research goes really well, and when things go badly, they're very often the first to say, "Oh well, Dr. So-and-so, they were just doing their own thing. We can't police everybody." Well, in a way you can, if you prioritize certain things, and I think some of those things need to include institutional awareness and institutional accountability for things like data availability, for things like transparency and data sharing. So if we get into a situation where we're not even sure this paper is real, we don't even know, was this just, bought and paid for? Is this even based on anything? That institution has to be the first place to go, has to be the one to go back and say, okay, Dr. So-and-so, does this exist? Where is this? Do we have this? And they need to have had those systems in place that they can assure themselves that they can get a yes answer to that, and they have what they need, and they can be institutionally accountable to the scientific community and the public at large. And so I think the number one thing I would focus on to sort of re-answer your question is encouraging and facilitating those institutions to take that lead role, to implement practices at their institution that would at least allow them to address and identify these sorts of issues, like papers, being bought. It seems kind of basic to me, but I think one of the ways that you prevent that sort of thing from happening is institutional assurance that the data is there, and the institution taking responsibility and accountability for that paper.
Thank you, Pat. I didn't know, Percy, if you wanted to elaborate a little bit more. Clearly, we should create more awareness regarding the importance of taking action as a first step, taking action at the institutional level. But perhaps many of you are thinking, well, it's so hard to do research. We have such scarce resources. And I also think that there may be a perception, reading between the lines, that there's very little expertise in scientific integrity as a field that actually requires expertise, that we're not just talking about people with good intentions, or that your mom taught you how to behave when you were a kid, that sort of thing. Go ahead, Percy. Yes, the first thing that I had to do when I joined the university was to create my own scientific integrity committee, add integrity coursework in the different curricula, and of course, develop the best practices. As Patrick stated, transparency, records, follow-up, evidence and traceability of all products is extremely important. But one of the key issues is that when we tried to implement and expand the integrity office, we couldn't find anybody with the proper profile to lead it because we didn't have any degrees with that specialization. Most of the people that are involved in this have just learned on the fly, and many of us come from the editorial field. We've worked for magazines and other publications, and as part of that work, we've grown accustomed to other integrity issues such as plagiarism and other issues. So we do need more to be able to impose standards and impose mechanisms that prevent this kind of thing. And we need to conduct a great deal of training. Ever since we start training students at the university level, we talk to them about best practices. And if somebody says to them something about modifying a data point in their research, or wanting to pay for the research to have a certain bias or what have you, that's something that is discussed. But what I believe logical to everyone, and I think this is something that happened to us when we started seeing these cases, we went to the oversight entity and they said, well, it's impossible for a researcher to purchase an article. And of course, I would think the same thing until we saw the evidence that it was happening. And we couldn't really move forward with this until we actually had the possibility of exposing this to the media. And we saw a great deal of movement afterward, and there has been a strong push in Peru towards improving this. But like in all things, I think crises are also opportunities. In trying to identify these issues, we need to be aware that not everybody that works in research does things properly, but we cannot fall into the trap of paranoia. So at the end of the day, we cannot really make healthy decisions if we do not have the proper certainty about the reliability of our outcomes. I think that you're really touching on a very sensitive point, and this is at the very core of many questions there that are asked. And we talk about the issues related to training or teaching. So how do we train the person that will be the scientific integrity officer? And if we don't have that kind of a degree program in the region. So if you're having to learn on the job, that's not really the most prudent way to learn. And as Patrick was saying, when we look at the future generations, they need to know about these integrity or scientific integrity concepts during their university training. Sometimes I'm concerned about the responses that we see for problems or scandals that occur. And we often fall back on quick measures. or easy measures. And perhaps because we don't know how these things are done in other parts of the world, sometimes organizations adopt a position that's primarily informed by attorneys. And so they try to avoid any automatic sanctions to just get through the issue and maybe gloss it over. So when we talk about an automatic sanction without resorting to a proper investigation prior to that, then we have a problem. But the other problem is, how do we actually do an investigation with this sort of thing in any specific field? So I think that from that standpoint, if an institution understands the importance of scientific integrity and they take the necessary measures, the institution or the organization doesn't necessarily know what needs to be done. Say XYZ University says, okay, I watched the webinar. I'm super persuaded that this is very important. Now what do I do? Where do I start? Who do I call? So in that sense, I guess I'd have to go back to Pat. If in this rather complex institutional structure, we had to start somewhere, if we had to come up with a starting point, where do we find it? That's a hard question. I know. Sorry.
Yeah, yeah. I think you could start at a number of places. I think maybe one of the ways you might get that ball rolling is to incorporate more opportunities for responsible conduct of research training, across the researchers' sort of lifespan at your organization. Not making that a once a year online module, but something that maybe a few times a year you sit down and you discuss case studies, or you do it in kind of a journal club format, or you have a meeting with your lab group where you go through data management practices and you write up SOPs, and all of these are ways that you can have those sorts of research integrity engagements. But I thought you also brought up another interesting point about having somebody with the skill set to do this sort of a role at an institution. I think that's an apt observation, that this is now just becoming so front and center in the compliance environment, that there aren't a lot of people who have focused on it primarily and exclusively within research integrity. Like you see so many people with clinical research credentials coming up through the ranks. I know Primer is coming up with some ideas that they have additional certifications for things like research integrity and conflict of interest, in addition to what they're have been doing with IACUC and IRB professional certifications. So things like that will help. What also will help is when people like me and people from my generation in the research integrity space build out our offices, basically, and we're no longer just a shop of one, but I have people who work for me in the research integrity space. When I need assistance on investigations or need assistance delivering training. And so as it becomes more and more of an enterprise, and as it gets more focus, I think, within the regulatory and compliance environment, I think we'll start to see more people with the requisite skills. I think anymore this day and age, as a researcher, as much as you have to know about data management these days, you're almost halfway there, as a research integrity officer. But I take your point, and I think there will be more of that expertise coming through over the near future.
Thank you, Pat. Percy, I don't know if you had anything else to add. Yes, perhaps we can point out the issue that I've already talked about. It's not necessarily linked to clinical research. We have a great deal more control in the sense that we have IRBs, we have oversight and certifications for researchers. Really, what I commented on isn't so much geared towards that. What we have seen is more closely tied to researchers that are co-authors of studies, and they don't have any records for these types of projects. So the institution may have a record of everything that received financing, everything that went through some IRB, all of that. And this tends to happen when we're talking about productions that are done unofficially. So you have little capability for control, and these exist within a context that is restricted to academic capitalism, or so to speak, where there's a keen economic interest behind the study. And that's something that we need to consider. Now, we may have some cases in clinical research in Peru, and in some cases in Ecuador. We've seen this growth in the social arena, focusing deficient practices. Another thing that we have in the science field is that if we all measure everything the same way, understanding that we're all different, then clearly we're going to be doing things differently. Let's see, if you're going to try to gauge my productivity in social compared to a chemist or some other kind of researcher, this is the kind of thing that's happened in Peru, and we've seen it in other countries as well. The other big problem that we have when trying to implement policies is that a lot of this depends on the size of the institution. If I'm a hospital and I have an IRB, having personnel or staff for an integrity, scientific integrity function is going to be very complex. In Peru, we have the issuance or publishing of articles with very small committees. And so we might be able to get some support from national networks that can support our efforts, because I don't want to say that these cases are altogether frequent. The main function for these areas involves prevention, education, and intervention, mostly because we're trying to foster a culture of transparency and try to publish everything, because supposedly this is a key component that's important for us to change in research. Transparency and visibility. Everything that we do is available and transparent, and presumably this is going to help avoid these kinds of situations. But I think perhaps it's not so much that the issues are less present in the human research arena. I think that an IRB in English is established for a series of different tasks to determine whether a protocol is clinically acceptable, taking into account the treatment afforded to the subjects of the research. And we also need to monitor the research and see how it takes place. But no researcher is going to include in his protocol, oh, by the way, I'm planning to falsify my data. That's not something that we're going to see. So even with the best of intentions, the prior review by an IRB assumes many things, but they're not really in a position to really see. It's not their job, nor do they have their eyes focused on this. What is true is that these committees or these boards can do a lot of advocacy. We're talking about people that are firmly committed to ensuring at least one key aspect related to research ethics. And I would hope that we could reproduce vis-a-vis scientific integrity the progress that we've seen with research ethics in human in research. And there are those who say, how can we set up IRB? I don't see how this is going to happen. But nevertheless, we've seen a great deal of advance in the last 10, 15 years. So this is something that I believe that we can aspire to. I thought really interesting this solution of looking for cross institutions or interagency collaborations, because this could be very beneficial and it might be easier. And perhaps we could explore from the standpoint of PAHO some way to make this more plausible, or to perhaps make the guidelines more clear cut. Just like when we do some training with human related research, these are the basic elements. That over here we have what is clinically acceptable when we deal with human beings and what is not and what have you. Then we have, on the other hand, the tools on implementation. How do you set up an IRB? Perhaps we could think about initiating actions that could be similar, then that focus on the core points regarding the best way to incorporate scientific integrity into everything that we do. Now then, another thing that I believe to be important, and thinking about some of the points that I heard in Pat's presentation, is that we have to keep in mind that if indeed we see scandals that attract a great deal of attention that concern us, we also need to understand that we are conducting training that doesn't focus on scandals, that we're really focusing on real issues that arise very frequently. If you look at a data set, you'll always have that outlier over here. You've got this nice smooth curve, and then you've got this outlier over here. So what happens if I just cut that out? What happens if I just act like that never happened? I'll just throw it in the trash. Right there, that's a violation of scientific integrity. So we have to stop thinking that scientific integrity issues have to be some huge scandal. It's like a bad guy versus bird guy, a bad guy versus good guy thing. We're always trying to fight against terrible things, but I think there's a great deal more complexity in trying to understand real on-the-ground scientific integrity issues. It doesn't have to be this huge scandalous thing. We sometimes tend to look the other way when the issues are smaller, but yet it's still a compromise of the integrity of that science. And we see some of this glossing over of inconsistencies in the data. And even though that doesn't amount to a scandal, it's still a problem. And it's important for us to really consider what Pat was talking about in his presentation when he was describing how training in scientific integrity, not necessarily focused on large scale scandals, but avoiding poor data management, ensuring best practices and transparency in the entire process. Even data collection, I can see during some kind of data collection process whether or not everything is working properly. Like when we talk about the typical customary management of a laboratory. So responsible research is made up of different processes that make up the fabric of the work that we do in this kind of science that we're involved in. So Pat, I'm wondering if you could tell us a little bit about, let's say that we're not really thinking at the institutional level. Let's say we're at the level of a small research team. What can a research team that wants to follow the best scientific integrity standards should do?
Check each other's work. That's the number one thing that I recommend within that sort of lab group scope. Two, I mean, we see, too often in research, do we get shown, a nice PowerPoint figure, or, we never really look under the hood, right? And those sort of lab meeting times those to me, those one-on-one discussions with the PI, those project team meetings, there should be more focus on digging into the data and seeing what did you do this week? Where are those results? And then ask, what came out of that? What are you going to do next? To me, at that research group level, so much of it comes down to getting away from this. Just show me the results, show me the finished figure, show me, did this work or not, versus, the actual record keeping and data management and seeing the results before they're prettied up and put in a figure to convince you of something, but actually, having more of a group input and a group scrutiny on sort of the day-to-day experimentation and the data that's underlying the figures that are being presented. I really think it boils down to taking a look under the hood once in a while and looking at each other's data management practices and seeing how we all do it and holding each other to high standards, because we know that next week Dr. So-and-so is going to be looking at my notebook or is going to be asking me about this thing that I'm supposed to be working on this week. And so I'm going to have some results. I can't just throw them away if they don't work. Those sort of things at the group level, I think that group level accountability, not just to the findings and the results, but the actual mechanistics of doing the research and the data that gets recorded and documented, having that available to each other and having that discussed in a way that that supports a healthy scrutiny and accountability amongst the different members of the group for good practices.
Can I ask you to go a little bit further with this point? Looking at one of the questions that we've gotten in the chat, are there any additional measures other than this more pronounced scrutiny that a researcher or an research project should use once they have the manuscript before sending it out for publication? What step or what would you do to scrutinize that more thoroughly before you turn it loose? So I think many people that trying to use some of these software programs to ensure that there's no plagiarism, what have you. What would you recommend?
Well, to me, and I know it's a little old school. It gets a little bit away from the plagiarism checker. You should do that anyway. Obviously, that's important. But when it comes to the data and the findings that are being presented in a paper, to me, having that meeting, having that discussion before you send out the paper, you have that final draft. Okay, at some point during the generation of this manuscript, you've got to sit down with the people who actually did the work and say, okay, figure one, where's the data for it? How did you get from data to this figure? Walk me through. Do that for figure two. Do that for figure three. It's a long process, but it's worth it in the sense that it raises everybody's awareness of who did what and where everything is. It gives you that level of confidence that where just on a very basic level, how often do we see somebody in our research groups write a figure caption that says, they've got an image or something that says representative of n equals 5. How often do you think somebody ever sat down and asked where's the other 4? Show me the other 4. You wrote in here, this is representative of n equals 5. Cool. I see where this image is. Now show me the other 4 that this is representative of. We never do that. I'll, be the first, former researcher just, to admit, we almost never do that. just at that level, before you send something out, as you're engaging in those discussions as a group, that's sort of the level of scrutiny and that I'm kind of getting at. Like when you say this is what this is, you should not just you should be able to back it up with a little bit more than a sigma plot figure that looks like it came out of your journal article. Like you should be able to dig into that and show me the data, show me how you got there. And I think that's kind of a key sort of paradigm shift from the way a lot of groups do research, that they just show me the finished results rather than discuss, look under the hood and discuss the raw data.
Thank you very much, Pat, because I think when one feels or when one thinks about everything that you need to do at the institutional level, you never think about what you could do it in your own little room, right? In your own little group. And what you're suggesting in terms of scrutiny of the group work will force all of the team members to get this more in hand. Percy, did you have anything to say about this? Yes, I think that I've been reading the comments in the chat. I think that by and large, we all trust, and being in research relies heavily on trust and certainty with our team members, especially. But I think first and foremost, if we did this at a personal level or with your small research group, we need to look at the best practices. And like Pat said, we have to ensure transparency, information sharing, verification among peers there in the group, and we can address issues of plagiarism. Now, we do have AI and software that helps us more or less determine whether something was plagiarized, but that's limited. But when we talk about generative AI, which is, I think, a greater challenge now,
because the software we use are not very accurate yet to identify whether they were developed by generative AI or not. So there has to be even greater transparency. So a lot of journals are asking us to disclose whether or not we use generative IA or whether we use AI for any portion of our papers. So a big component of integrity is transparency. Be transparent in terms of our conflicts of interest, our databases, our records, our processes, and the role of an IRB is to have peer review, and a researcher that's on the right track sometimes complain about IRB because they cause delays, right? But they are open to showing what they're doing because they've done a good job. The risk is when the opposite happens, when people refuse to be double checked and peer reviewed and all that. That's when all the red flags start coming up. Thank you. I believe there's no session in 2024 where we don't mention AI. Pat, do you have anything else to add in terms of how to address the challenges as AI poses? Although that could be an entire webinar, but do you have a brief comment on that?
It's something that we wrestle with, and we try to encourage people to use it responsibly, but I'm not even sure that we as a community understand what that is entirely at this point. I think having things labeled is a good first step, but it's not going away. So we instead of resisting it, I think we have to adapt to it. But what that is going to mean for us, particularly in, for example, the publishing space, is very much very much an open question. I, I wish I knew more about it. I wish I had more insight into that question. But it does seem like every seminar you go to these days, somebody has to bring up AI.
Yes, that's the challenge of today, right? At least the one that's most widespread. Okay, so in terms of more specific or concrete questions, are there any training courses or certifications at international level on research integrity that's available? Because I'm just aware about like shorter courses like the lab that's available in Spanish and the like. I believe City a long time ago used to offer a course on scientific integrity, but the last time I checked, it was pretty general. So, my question is if someone would like to train as a research integrity officer, what path would you recommend?
Yeah, that's my advice would be to find a research integrity officer and see if they'll let you work with them. There's that's how I got started in this line of work. And if you are somebody who's engaged with your compliance program on some other level, it might be a little bit easier for you to engage with people who are already involved with research integrity. But I'm not aware of any formal certifications. I know there are different programs, like you mentioned, City and the training programs put out by ORI. There have been PI focused programs in the past. I know the PI program was more focused on remediation of potential research integrity issues. But I think they retooled that later on to be a little bit more broad and general about research integrity principles. I don't know how I would, recommend somebody move forward to getting that training other than just, trying to become the person at their institution. There is a lot of on the job training, and then there's a lot that's going on in the broader research community online. There's so much of a community and so much discussion that goes on around these issues. Data sleuth blogs and Retraction Watch, obviously, PubPeer, Elizabeth Bick's website, and some of these other folks that work in the research integrity space. Just having a spectator's kind of interest in following what's going on in the research integrity space really does kind of clue you into some of these issues. I never would have been aware that, paying for papers is still so much a big deal until I, went to, this kind of talk. And so, engaging in these sorts of things can be another big thing too. There is a research integrity officers professional organization called ARIO that I'm a member of, that you can see what sort of programming they offer. And I think they may be working. They have some sort of a mentorship program. I don't know how open it is. So I mean, those are just sort of my scattershot ideas, but not a lot of formality to it right now.
Percy, are there any regional training courses or resources that you know about? In addition to the CD program that's being used at several universities like ours, I'm not aware. As a result of the issues that I outlined in Peru, we are developing some tools with our regulatory agency, and we're trying to see about partnerships to develop that because there is a big lack in this area. And another thing that happens a lot is that those of us that could identify these things are not attorneys or lawyers. And so
Mhm.
we would have to follow like this entire like interview process, evidence collection, and and we all have our own scientific training and we could even pinpoint issues. But in terms of the whole interrogation or interview process has to be in line with what your national legislation provides for. And there's also a very big missing link here. Just like we have trained attorneys who work on research ethics, we need to do the same about research integrity to help us in these processes. Because at the end of the day, whenever we find cases, there's a sanction imposed, but then they take it to court and it was determined that the legal steps were not followed, and so it all goes away. That's a very important topic because even though there is a legal role to play in this sense that the sanction has to, if it's national, it has to follow the national legal framework. We need to know that this is not just an attorney issue
Yeah.
or not exclusively. And involving scientists in this topic is just as important. And not only is it important, it's unavoidable. It's absolutely necessary. If someone does not understand how science uh, works on research, it will be very hard for the person to assess how serious an infraction or an offense may be. But I'm glad that you mentioned the issue of sanctions because somebody asked whether there's some sort of like supranational agency to sanction these types of unethical practices in research integrity. So rather than saying, I mean, in addition to saying this happened and this is terrible, what kind of strategies, Pat, can you think of if you identify that a violation occurred and your country does not provide for any kind of ways of rectifying the problem?
Mm. Well, you can only do as an institution what you're, allowed to do as an institution. But, that can include a lot of different things. If you're not given guidance through your agency about how they would handle sanctions and debarment like we do in the United States, then I think it may be even a little bit more incumbent on you to think about how much you're going to say about what happened here publicly. You have an obligation, and I tried to separate these two concepts to correct the research record. So as soon as you're able to say this data is not reliable, these findings, this paper can't be relied upon, you have an obligation to correct that paper or retract that paper as the case may be. You're going to come to that conclusion well before you come to the conclusion that there was a misconduct issue here, and there's more that goes into that determination, where you talk about somebody's state of mind, what they should have known, what was outside the boundaries of good scientific practice. But just on a fundamental level, if you say, hey, the data here is no good, we can't rely on it, that's, enough to at least, retract the paper based on. And so that is that's a retraction that shows up on somebody's CV. That's never good for them. But you're also, depending on your legal structure and what your institution allows you to do, after that point, you may be within your rights to go out and say, okay, well, we looked into this and this is all that happened here. You know, that could be a very wrought legal determination about, what you can say and what you shouldn't say about a misconduct finding you did or didn't make if you're not getting agency support in making that determination. But as far as sanctions and debarment, even within the United States, when there's no super agency that determines all of this, even within the HHS NIH, those debarments only count for money within HHS. There's other federal sources that you could presumably be eligible for. The only way that somebody might question your how suitable you are as a potential recipient of grant funding or as an employee is to have that information out there in a way that somebody's going to see if they pull that CV, if they look for that paper, at the very minimum that retraction was done. And so as far as sanctions, you can only control what you can control. You can control everything within the scope of your organization and who you choose to employ, however. And I think if you're at the point where you're retracting a paper based on data that's not reliable or that, doesn't support the findings, you're at the point where that researcher has already violated your expectations as an institution, that they didn't collect and store and curate that data in a responsible way so that it could support that paper. So you may be, I think, potentially already at the point where the sanctions that you would make as an institution to potentially fire that individual are probably already met at that point.
I agree. I believe a lot of the resources you mentioned are not very widely known in the region. For example, the websites to retract articles. So maybe from PAHO, we could disseminate those websites because they are valuable resources that truly impact the researcher's career path. I don't know if there's anything else that Percy you would like to add to this. Well, in the case of Peru, we have our National Research Integrity Code. And one of the things we worked on is to add violations that were not included before. But then we have an issue with papers. We need to properly define a paper so that we can determine whether or not there was an error. But we still need to develop expertise. So it is a challenge to implement processes to identify and sanction. One of the things that happened after these cases went out in the public is that we received a series of reports, like I see on the chat, but the majority of the reports we received did not come from people that were not accusations against unethical researchers, but rather ethical ones. Actually, the people that sold papers initiated this campaign against me because I was hurting their business. So in this whole integrity process, we need to protect the witness that submits the report, which is a very important component, because otherwise you will not have all of the information about certain um,
Mhm.
issues. And so it's very important for you to bring this issue to light, that even though it does not impact the entire community, there are several cases, and we need to at least ensure that our findings and the way in which we conduct research are correct in order to preserve the integrity and the reputation that we need. Thank you, Percy. I believe that you are highlighted something very important that you mentioned over and over again, which is credibility in science. And in that sense, we are at a very important junction to attract attention and resources to all efforts related to research integrity. I believe during the pandemic, we all witnessed distrust to science. And I believe that one of the greatest threats to public health is reluctance to get vaccination, which started historically as far as part of research integrity. This paper falsified information and it misled people. And now we have actual serious public health issues because of research integrity issues. So I believe that we are at a very important moment to take action, and so that PAHO can escalate all of the support efforts to this. And I believe that this whole discussion gives us several lines of action on potential work that we could engage in the future. And I'm just picking up, from different comments and questions that we received. Just like we have the SIAMS guidelines that everybody knows about and reference, maybe we should have some sort of similar guideline with the same level of granularity for research integrity, not just basic, like Pat was saying. If we're going to shoot for the best, let's not settle for the minimum. Let's go above and beyond the bare minimum. And that is the basic reasoning before research ethics in humans. So we should follow the same guidelines and to have some sort of material for research integrity. That's for the substantive research. Then a second point is related to how to implement this in practice. That is to say, how do we implement the processes? How do you conduct research after an allegation has been made? How do we handle things so we don't harm science or the people that may have been falsely accused? What parties should be involved? That's a different type of guidelines that I believe is missing. And then a third important point is the need for training in this area. That is to say, specific training, just like we do for other areas and for different audiences. Because on the one hand, if you want to have a career in scientific integrity, you need some kind of training. But if you're a researcher that wants to make sure that in his or her lab or research center things are done ethically, they need a different type of training. So we need like different layers of training. And I believe we need to start developing strategies to put together the training with the level of granularity that each audience needs. And then, from a more practical point of view, while we create all this or develop this training, we can think about mechanisms that can help us as we go about this. So maybe networks, exchange mechanisms. Pat was saying that if you want to train, you should we should go talk with someone that's already working in that field. So could we think about like internships, for example, international exchanges? I believe that we need to think about very specific options to see how we can make progress. I don't know if you have any final remarks, Pat or Percy.
I've
Go ahead.
talked enough.
How about you, Percy? Any final comments? Well, thank you for this opportunity. And again, we need the possibility of building efforts because this is a regional need. So thank you for the opportunity and thank you for focusing on this issue because I believe that a lot can be done together and we need this. Okay, this is something new for us, as you know. This is a little bit outside of my area of expertise, but we can't pretend that this does not impact research ethics. When you ultimately do research to improve people's health and well-being, and if research is not credible, or if research is going to be done fraudulently, then we're not going to achieve our ultimate purpose. So we need to make sure that we guide and support the region in this need. So we're going to conclude today's session. We would like to invite those of you who have not yet registered to join our research ethics mailing list. I'm going to paste the link on the chat now because you can access the recording for this session both in English and Spanish. And also you will be invited to our next session, which will be in December. This will be our next webinar in this series, where we will be talking about some efforts that we've been making to seek efficiency in performance of clinical trials. For example, how do we join efforts to make sure that contract review is more streamlined by having, for example, standardized templates, and the same goes for insurance policies. So you will be receiving your invitation through our mailing list, and we will continue talking about all these topics of interest. Thank you very much and enjoy the rest of your day.